To be mindful and respectful of everyone's time, I believe that we should start this webinar today. First, I would like to thank all of you for taking the time to join us. I will make sure this is clear and it doesn't take much of your day. My name is Catherine Adames. Currently, I am the Director of Interpreting Operations at Effective, and we will be reviewing what it is or how we can coordinate a language access plan throughout this webinar. Just so that you know who I am, where I come from, I have a very humble and wonderful background on the interpretation industry, starting from an interpreter. So every time I discuss about something that is related to the language industry, I would always go back to my roots and set examples of what it is to be an interpreter and how all of this that we will discuss today can at the end affect an interpretation rendition or an interpretation encounter. So coordinating a language access plan. This is for all of you that at any moment need to make sure that everyone in your communities or in your areas, the places where you work, the places in which you have a leadership can receive the adequate language services. We all know that this is by law, and so we're going to just go through a few steps of what needs to happen to make sure that everyone gets these services from you. Just so that you know, this webinar is being recorded for the sake of everyone here, and each of you will be receiving it to your emails. Also, at the end of the webinar, we're going to have a few minutes for a Q&A. You're welcome to wait until we finish this encounter, and I'll be more than glad to answer to your questions. Okay, so effective communication is critical when it comes to making sure that there is an understanding and also empowering our patients and our clients for us to provide them with high quality care and service of any type. A language access plan can help make sure that a staff member is aware of what to do when an individual who does not speak English or has a limited knowledge of English needs help. Our coordination or plan identifies ways that providers of all types of services can assess their programs to make sure people with limited English proficiency have meaningful access to what is offered in their communities and or public and private organizations. A few facts that we would like to introduce you to. The first one is that nearly 10% of Medicare beneficiaries are individuals that do not speak English or are very limited English proficient. Also, entities that receive federal financial assistance, such as Medicare Part A, Part C, and D, must take reasonable steps to provide access to their programs by people with limited English proficiency, and what we know in this industry as LEP. Reliance on unqualified individuals to interpret medical and all other type of information can lead to misunderstanding and very devastating outcomes. Now, what is a language access plan? This will be a document that can spell out how to provide services to individuals who are non-English speaking or have limited English proficiency. This plan will provide access, and it should be tailored to individual organizations, but may also include similar sections such as needs of assessments, language services offered, notices. We should always train our staff on how to provide language services. And last but not less important is evaluating our language access plan. When it comes to needs of assessment, we will discuss all of these 5 points that actually make our language access plan. This image that we're showing on our screen here has been extracted from the U.S. Department of Justice Civil Rights Division's website. And it is basically a document on elaboration of what a language access plan should look like. Under the needs of assessment, we should always obtain the number of individuals with limited English proficiency that come to our organization, their point of contacts, stakeholder engagement. The second, which is language services, here we will, at this point, we will develop policies and procedures, or what type of interpretation or translation services we will be providing to our community. As per notices, we have examples of I speak cards. Obviously, very important that the patients know their rights and responsibilities. Also, the use of taglines and signage. And when it comes to training, which is the fourth step of coordinating a language access plan, we will know who in our organization, if not all, are in need of getting this training. And also, we should be monitoring and evaluating our language access plan. So who should have a language access plan? This is a very important part. We don't want to violate any laws, and so we should know whom is able to provide language access, or who should. Actually, any organization that will be serving individuals with limited English proficiency should develop a language access plan. More specifically, we can look at organizations that receive federal funds, such as certain hospitals, health plans, community-based organizations, and others, as well as organizations accredited by entities such as Joint Commission or National Committee for Quality Assurance. Our plan focuses on individuals with limited English proficiency, and we also must mention those individuals or consumers who are deaf and hard of hearing, or that they're blind. Within our plan, we need to specifically state which kind of services these people are going to be obtaining. And just so that we don't forget the legislation, we should respect Section 504 and Section 508, which are the amendment to the Rehab Act of 1973, and also Title II and Title III of the Americans with Disability Act, which was updated on 1990. This image here is what the U.S. Department of Justice considers that are the 4 factors of how we should evaluate our language access plan, starting with the number of portion of people with limited English proficiency who are eligible to be served, the frequency in which these individuals are going to utilize or come in contact with our programs, the resources that we are able to offer them, and with no cost for the consumer. This is very important. And also the nature and importance of the programs, activities, or services that we are providing for our organization and their beneficiaries. Before we can create a language access plan, we should assign a person or a group of people who will be responsible of overseeing the organization's language access plan, maintaining a database of qualified interpreters and translators, and making sure that the correct company is hired to provide quality interpretation as well as translations. This person or group of people will also be responsible of training the staff on how to utilize language assistance services when serving the customers. Also coordinating and managing requests for interpretation and translations. Managing a budget to provide language assistance services, and also regularly assessing and improving the language assistance program. Now we're going to detail these 5 steps that we must follow in order to coordinate an adequate language access plan. The first One is assessing the need, making sure that we have enough data, enough documentation to know the languages that we will be providing services for, and also translations for. If the organization does not have internal documentation of their participant or program participants or patients, then each state and also the US Census Bureau provides very relevant information that will be useful for the coordination and the needs for assessing this plan. First, obviously, we would need to know how many people in our community or come to us with limited English proficiency, who in our organization they would come in contact with, beginning from the security guard and finishing with the mail that they will be getting. Also, the call center, if we have any, for an individual to call in, reception area, and other individuals within our organization. Also, what are the levels of interactions that these people are going to have with the LEPs, and as well as the stakeholder engagement. Within the level of interactions, we can mention the hotlines or information line that we may have in our organization, as well as the outreach programs, the public meetings and hearings, which has become very famous within our industry right now. We're servicing for hearings and public meetings. Also, our websites. We want to make sure that those people accessing us directly are also able to get information through our website of our services and just all the things that we're able to provide. Written materials or complaints, and also brochures that are intended for public distribution. And when it comes to stakeholder engagement, we should always ask for feedback from our community based on the services that we offer, not only the language services, but also everything else that we're offering to our community, and allowing them to have a language access will facilitate this for your organization. Also, when it comes to conducting customer service satisfaction and surveys of the applicants and the beneficiaries to our programs. Once again, I would like to mention that all of this information that we are providing today is available for you to view at the U.S. Department of Justice website, their Civil Rights Division. So before I mention the point of contacts in our organization, and this is an image that just has a few staff members who might come in contact with our LEPs. We have the security guard, we have the call center, the reception area. We want to make sure that at reception, people are able to get services for the languages that they speak, and also that we provide some sort of privacy for them to, explain to the receptionist or whomever what type of services they will be utilizing. And of course, if it's in a hospital encounter, the exam room, and also allowing them to get mail within their language, in their language. The second step here is, what language services are we going to provide? And who will be that company or people that will allow us to provide quality services for both interpretation, if we want to provide interpreting. Also, when it comes to interpretation, we ask the question of, are we going to only need over the phone interpreting? Are we going to be utilizing video remote, which has become very famous after the pandemic? And I personally, as an interpreter, like it a lot. And also, will there be people who would like to come on site to offer interpretation services? Also, are these services going to be consecutive, which is, for those of you that don't know, if consecutive is when the speaker pauses after 3 to 5 sentences, allowing the interpreter to interpret, whereas simultaneous is used more for on the legal side, and also, as we mentioned earlier, we're seeing this as well for like public hearings and things like this. And just to define simultaneous or to describe it, it's when the interpreter is speaking on at the same pace of the speaker. You've seen this in the United Nations probably, or in beauty pageants. Okay, so when we answer the question of we need an interpreter, we need group of interpreters, we want to make sure that they're also qualified to service our organization. Are they medically trained? Do they have legal certification? So at the time that we are going to hire a company, we must ask these questions. And then when it comes to translations, we want to make sure that our community has application forms, including those for benefits when it comes to a medical or insurance encounter, are translated. We want to translate consent forms, including consents to treat. Here, I would like to just mention this. Imagine that you're going to, if you're in a hospital, imagine that you're going to get a surgery. And honestly, when a doctor explains things to you, they don't really, some doctors don't really go out there and explain to you, in ways that you're able to understand. They will utilize medical terms. Imagine that you're being treated or are going to have a surgery, and they tell you that you're going to get X surgery, and you don't know what that is. And since the document is in English or a language that you don't speak, you just go ahead and sign without knowing what they're going to do to you. A very important part of consent for treatment is also that there are religions that do not allow for a blood transfusion, and we want to make sure that people understand what they're getting done. So part of translating these documents is this. Also, release of information, and now very famous, a consent to immunize with all the vaccines that are going around. Also, we want to make sure that they understand a complaint form and that they're able to fill it out, as well as eligibility forms, financial payment policies. They need to know what their rights and responsibilities are. So we want to make sure that this information is in their native language. And this will include the availability for language access services, as well as intake and information forms. And also patient instructions, including what to do in follow-up from an appointment, such as discharge summary, or what to do in preparation for a procedure, such as fasting prior to blood work, what time should they be at the hospital for a surgery, and so forth. Now, notices, which is the third and also very important part of our coordination or plan for services, language services. We must make sure that people know that there is a language assistance wherever they go. And I will show you what is a iSpeak card. I will provide you an example of it. But basically, these are cards to help identify what language an individual speaks and to identify what language interpreter will be needed so that they can communicate, the staff member and the LEP can communicate adequately. Let me just skip this for a little bit so that you know. You will probably find these in hospitals, and the LEP will be able to point to the language that they speak. And on the right side of this card, you would have in English the language that the LEP speaks. This way you can call out for your interpreter or whatever type of interpreting services you may have. Also, as part of notices, we will have user notices, of course, and then patient notices as well. Our organizations should provide notices to patients in their own language. And we should inform them as part of the notices that they can get an interpreter to provide them with language services at no cost. This is very similar to the iSpeak cards. Patient notices will contain a statement in English in a variety of languages to allow individuals to point to the language they speak and get assistance from our organization with an interpreter. Then we also have taglines, which is another way to provide notices. This could be through taglines or printed and electronic materials, such as other notices that we have already discussed. And for example, a tagline written in Spanish might say, I speak Spanish. And then no, my apologies. If you speak Spanish, language assistance services are available free of charge. Please call this number for assistance. Also, there are public taglines and I speak cards and notices that you can find in the website for the Department of Health and Human Services. And also they're provided at the Office for Civil Rights. Again, this is what you will see as an I speak card. I personally have seen them the most in hospitals and reception areas. These are very useful. This is the one that we provide to our customers at Effective. And this part is so important. And I dwell on this one as an interpreter. And I would just say that sometimes as interpreters, we have had to provide training to staff. This is not part of what we should do, but just to make sure that the interpretations encounter is clean and that everything is provided adequately and accurately for the sake of, the patient or the person who is getting the services, that the folks that are assisting our LEPs know why it is important to provide language assistance services first, and then how to effectively and respectfully communicate and interact with individuals who do not speak English or are not English proficient. Also, we should train the staff on the organization policies and procedures related to providing language access services. This may include the ability of interpretation and translation services that will not be charged to them. This part is very important because it will provide also to the company that you might hire information or data that will be so useful when it comes to providing the right languages that your community will need, and also the type of training, and will also provide a cultural background for that company and also the interpreters that will be servicing you. How staff can capture data around consumers' languages, needs, and their preferred languages. A big mistake that we have seen around, the data capture is with Mayan languages. Sometimes this information is captured as if this LEP speaks Spanish, and in reality, they don't. They speak Quiche or they speak any other Mayan languages. So we want to make sure that information is available and that we know exactly the language that these folks speak. Also, the procedures to request and work with an interpreter, including when to use an interpreter and what type of documentation we will be translating. It is very common that people confuse translators with interpreters, and also there we come as interpreters, we educate, we say interpreters are verbal and then translators are for documents. Something very important is that you include this training for your staff as part of their onboarding process. And of course, always provide refresher trainings for your staff, as well as when you obtain, let's say you hired a company just for over the phone services through the telephone, and now you hired the same company for video remote services. You want to make sure that your staff is up to date on the services that we're offering and how to utilize the service adequately. The last part of our plan should be the evaluation section. And this will allow us to monitor the organization's response to complaints or suggestions by individuals with limited English proficiency, the community members and employees regarding language assistance, if they are feeling comfortable with the language services that are being provided. Do they think the staff that is servicing them has the adequate training and manages the vocabulary to make sure that the encounter is fruitful? Are the interpreters that are providing services being respectful and abiding by the code of ethics of the interpreters? Which also should be part of training. People should know, organizations should know, staff members should know that interpreters have a code of ethics and they should abide by it. We should be keeping current on community demographics and needs by engaging local public health authorities, school districts, faith communities, and refugee settlement agencies. An example for this is when we have a state, for example, that was welcoming refugees, and your organization contracted a language services for X language. But now there are not that many refugees from that language, and you have welcomed in other refugees. What language do they speak? Do I have the interpreters to service and to interview them to make sure that they know which services we're able to provide? Also, we should always monitor the utilization rates of the different types of languages or language access services being used throughout the organization. We should also be conducting surveys of the organization's consumers about their experiences using the services, including language assistance services, and we should be collaborating as well with other agencies using emerging technology, staff development, and other mechanisms for ensuring improved access for individuals with limited English proficiency. Okay, so to conclude and respect your time, just want to mention a few pointers so that you keep in mind and understand why it is so important that we coordinate and create a language access plan. Is that without an appropriate interpretation and translation services, it can be very difficult to communicate effectively with individuals with limited English proficiency, which can result in liability related to poor health outcomes, lower patient satisfaction, and violation of federal law that prohibits discrimination based on national origin. When I've had the opportunity to train interpreters, I always tell them, just imagine that your grandparents are in China and they cannot communicate adequately after, God forbid, they have a car accident. We want to make sure that the people who provide services to them are well trained and that they're also able to get language access. And when it comes to the second point, there will be lower patient satisfaction or user satisfaction among individuals with limited English proficiency who need interpreters but do not receive them, and among individuals who receive language services either from ad hoc interpreters or from non-medical or specific service type untrained support staff. This is a personal experience here. Just imagine me being a 10-year-old going to an appointment with my father a few years back, and he was going to get a colonoscopy. I, a poor child of 10 years of age, explaining to my dad what a colonoscopy was. So this, just imagine the craziness that happened there and how shy, I can't recall perfectly, but how shy was I or how shy was the doctor when providing this information to my dad? And this happens many times in many organizations. And then the person who came for services might leave through the door with more questions than answers. And lastly, providing high quality language access services at each point of contact is critical on high quality care for all services that we offer. Working through the steps described can help ensure that an organization is well prepared to provide language assistance services and care to individuals with limited English proficiency. Developing a language access plan that includes the section described can provide helpful guidance to an organization as it works to meet the most important legal requirements and ensure high quality and equal care for the customers with limited English proficiency. Now we are on our Q&A session. You are more than welcome to ask your questions. Okay. We're going to allow 5 minutes for you to maybe think through your questions and send them over. We have a question from Andrea asking about recommendations specifically to schools. Yes, you want to make sure that all the parents, all the staff members are able to understand how they can provide language services for the parents and the students, and at which point they can have the services offered. IEPs, for example, we want to make sure that the parents know everything that is going on with their child. We want to make sure that the parents are also in cooperation to the plan that the school has, as well as translating this documentation. We want the parents to have a record of their IEPs, and this is something that I personally consider great. I want to make sure what my child is going through in school, and I want to make sure that I know which plan the school has for them, and I want to also cooperate with this plan that the school has. Thank you so much for your question, very important. Elizabeth, thank you. Thank you so much. My pleasure. This is all being recorded, and we will make sure that all of you have access to this. iSpeak cards are available at the U.S. Department of Justice, just main ones. And also, if you would like, we can share the one that we utilize at Effective, the one that we share with our customers. There is a question from Nicole. What will be the most effective approach to measuring program accessibility? This is a great question. As part of our presentation, we showed the 4 factors image that talks about finding out the number of LEPs in their languages, the frequency in which they're going to utilize our services, what resources will be available for them, and what is the nature of our programs. They need to know this. Thank you so much. You're welcome, Andrea. How to identify a language over the phone? Because the iLanguage identification cards can be used over the phone. Okay, this is a great question. There are 2 ways. When we're utilizing language services through an app, many apps that are being provided now, especially for this reason, allow the person to see from a list of languages which language they speak, and allow the LEP to select from this list of languages. Also, organizations allow when the call, an example, when a call comes in, some organizations allow the LEP to select their languages. So they would call a 1-800 number, and they would say through the IVR system, I speak French, for example, and they will be able to be connected to a French interpreter, and the interpreter can greet the consumer. The interpreter will then let the staff member know that they have a French person on the line, and they will go ahead with the encounter. Next question, can you please explain one more time why monitoring is a big part of the organization? Why would you have a plan if you can monitor if it's working or not? As one of the slides said, it is very important for the organization to respond to complaints or suggestions from the LEPs, as well as the community members and their employees regarding the language assistance. That was a great question. All of your questions are fantastic. Any other questions that you want to send my way? I hope I don't miss any. Just want to mention that you're more than welcome to send me questions to my email Catherine with a K, ATHERINE .A as in Apple, @effective.com. And I will be more than glad to share this presentation with you, as well as sending you any response for your questions. Thank you, Joelle. Thank you so much. Data collection. Best way to collect and monitor data. This is awesome. Some organizations, well, the best way to start collecting data is to make sure that you go through and that you evaluate your state or county census. And then from the people that come to your community or to your organization, making sure that you gather the language they speak. How do they want to communicate? Would they like to receive mail information? There are programs out there that are free that can allow your organization to collect all this data. And us here at Effective can also assist you with putting together a plan for this specific monitoring of the data. Thank you, Elizabeth, for your question. Other questions are welcomed. I will allow one more minute. If no questions, just this will be available in when we send over this recording. The resources that were utilized for this webinar, they're public, they're publicly accessed. We made sure that everyone that put together this research was here on this slide. And lastly, I would like to thank you for your time today, for your wonderful questions, and our team will make sure to send over this webinar your way. Thank you so much, everyone. I hope you have a great weekend and great festivities coming up. Bye-bye.